welcome to this edition of the First Aid Show. What we're going to cover on this edition is a little bit more information on snake bites and what to do if you've been bitten by a snake. In the UK, there's only one poisonous snake, and that's the adder. Other snakes are kept in captivity which are harmful, but these are not in the countryside. In the UK, there's hundreds of people who are bitten by adders, and an unspecified number of dogs are also bitten. Generally speaking, snakes do not attack. They would much rather move away from people and dogs, but when they are threatened, they can bite. This could be when you're walking in undergrowth, and with dogs is when they try and play with the snake, causing it to bite. The common times for adder bites are from February to October, with the peak season from June to August. Many people are bitten on the toes or the feet, but in half of all cases, people are bitten on the hands. This is where they try and pick up the snake or even try to kill it. Even a dead snake does have a bite reflex, so leave them alone even if they're dead. People who do outdoor pursuits of all types can come across snakes, as they are in riverbanks to cliffs, so whether you're a walker or a rock climber, always be aware at all times. When you're bitten, you may just think you have a small cut, but the area will swell very quickly. It will start to feel like a wasp sting, and you may keep walking on it for a while. In 5 minutes it gets worse, and often in 15 minutes you wouldn't be able to walk on it if the bite's in your foot or your toes. The area becomes very red, and the bite mark becomes like a white circle, and after a while red blotches will appear all over the body. Dizziness, chest pain, vomiting, breathing difficulties, stomachache and unconsciousness can follow. An anaphylactic reaction can occur as the body reacts to the poison. Watch out for a swollen tongue and throat. Hospital treatment is required as soon as possible so the correct antivenom can be given. If it's possible at the time of the bite, look at the snake or take a picture, but only if it's safe to do so. Then the doctors can establish what the snake was and give the correct treatment. The general advice for treatment is to activate the emergency services, note the time of the bite, reassure the patient, do not bandage it, and avoid interfering with the bite. If pain relief is given, use paracetamol, not ibuprofen, as ibuprofen can cause bleeding and clotting problems, which will make things worse. It may be necessary to splint the limb if possible to reduce movement and also slow down the transit of the poison around the body. Finally, where there is swelling, it's a good idea to mark the edge of the swelling with a pen and note the time so you can track the swelling progress.